Dr. Zargouni?
Hello.
How are you, Harold?
Fine.
Pleasure to meet you.
Pleasure to meet you too.
So
You're
this
welcome.
is your clinic?
Yeah, this is our clinic. We're working on it since 3 years now. It's the oldest clinic in Tunisia. It was founded in 1932.
This 100-bed facility in the heart of Tunis is the oldest clinic in Tunisia, but it's also part of a new trend.
They come in from far from our country. They usually have people around them, and they already suffered in their country, waiting for the money to get their money to come here, waiting for their doctors to try to diagnose the problems before, and time is really important for them. And for us too, because when the patient is treated, we have the place for another patient.
It's begun catering to medical tourists.
Madame Gayoumta is a patient coming from Chad, and she was sent to us for a case of neurosurgery from there with a wrong diagnosis.
From major operations to elective surgeries.
Madame Pichard is a patient coming from France. She came 2 nights ago for aesthetic surgery.
So tell me exactly what Madame is having done.
Madame Pichard is here for liposuction and an abdominoplasty. And this surgery is a surgery that we do nearly every day for this kind of patient.
Zargouni says the procedures his staff performs are as diverse as their clientele, but it's one fact that keeps his beds full.
They come here because they're gonna find everything they want for less money.
He says many procedures can cost around half of what the same procedure costs in Europe, and that's largely due to lower taxes. For many in Tunisia, though, the cost is still too high, which means they have to go with public care. So Zargouni's private clinic looks for patients abroad.
The patients come here from the airport. They come to the clinic, they see the doctor, the anesthetist. We make biology, radiology, and we start operating. 2 days after that, they go to the hotel for 4, 5, 6 nights, and they come back to see the doctors before going back home. So it takes nearly a week for them, and they go back home new.
لازم تكون juste un petit passage معناها جات حاجة تعديت complètement mais elle n'a pas eu de dégâts.
I think the most interesting thing for them is the price. That's the most motivating reason for having surgery in Tunisia.
Travel agent Haifa Najjar began her focus on medical tourism 6 years ago.
A lot of patients come for the first time over here, so they have no information about the country itself. They have no idea about the health sector over here, so this is all very important.
After the country's revolution, she now spends her time reassuring clients that Tunisia is safe.
People were much more reluctant about the trip to Tunisia, so first they ask a lot of questions, they inquire, they would like to make sure it's quite secure, so it takes much longer. Sometimes at the last moment they can cancel their booking. The moment things got a little bit more in order in Tunisia, I think now we can say it's like normal, so people are coming much more than after the revolution.
According to the president's office, in 2011, overall tourism in Tunisia declined. But the following year, the industry grew by 3%. The head of Tunisia's Union of Industry says that's in large part due to medical tourism.
We receive every year millions of people from Algeria, from Libya, from Africa. Here we have a very healthy weather, and we can offer more services for them. So I think for the health and all medical field, it will be a good opportunity for us.
We have new flight for Burkina Faso, for example. We have direct flight to Mali, we have direct flight to Ivory Coast, to Mauritania, and of course to Libya and Algeria.
Back in front of his new MRI, Zargouni tells me his clinic received more patients throughout the Arab Spring, particularly from Libya, a country that saw its healthcare system decimated during its revolution.
So this is all one part of the business, but how do people afford the cost of coming all the way to Tunisia, bringing their family, like you say so many of them do, and pay for this private care?
Yeah, the neighbors, Libya and Algeria, we come for nearly everything. small things and big things. So generally they pay like Tunisian.
While fewer Europeans are coming because of the unrest, the amount of African patients is increasing.
In medical terms, Tunisia is the baby brother taking care of its African neighbors.
We really see it like that. I go to visit African country, I try to meet doctors over there, I try to convince them to come here. So every doctor and every clinic director try to do this because we want to work on that. We think that it's our future. They win because they pay less than France. They can come with not a lot of papers and a lot of things to do. And we win because we have patients and we can afford having this equipment.